Good morning.
Good morning.
Several of you I've met along the journey, but many of you are still new to me. So let me just tell you a little bit about me. I'm Joni Way, and for the past 18 months, I've been both your conference treasurer and your benefit officer. And I told people when I interviewed for the job that I thought it would take me about 18 months to figure out what I was doing. And I think I'm just about there. And I'm so grateful that this transition on the retiree medical plan happened this year and not when I was only about 6 months old. About sometime after Thanksgiving, very close to the end of the year, we learned that the premium for the medical plan that we have been offering you guys currently was going to go up by 30%. And it came, as I said, very late in the year and didn't afford us a lot of time to react to that, which is why we're having this transition in March instead of in January. But when we realized how much the premium was going up, we knew that for most of you, that was going to be $400 a year to you, and we weren't happy about that. But we also realized that because of the subsidy that most of our retirees receive on their Medicare plans, that it was going to cost the Board of Pensions close to $400,000. And so we knew we needed to make some sort of a change. We sat down with our consultants who advise us on our insurance policies, and we took their recommendations to the Benefits Committee of the Board of Pensions, and then onward to the full committee of the Board of Pensions, and they selected this product. It's a Medicare Advantage product, and for years we've had many retirees who have asked us for this product because there are some benefits in it that they really look forward to having. So I am not your insurance expert, the Anthem folks are, and they're here with us today to explain the insurance policy. Celeste and I are the ones who administer the product through the conference office. You know, we're the ones that deal with the billings and the payments and those sorts of things. But the real questions about the insurance, the Anthem folks are going to be much better qualified to answer than we are. So do call us if you have questions about the administrative side of it. If you have questions about the insurance, we will encourage you to reach out to Anthem directly so that we'll make sure you get the answers straight the first time. So with that, I'll take some quick questions if anybody have them about what's going to happen today. All right? And then Celeste is going to very quickly introduce just a few things, and then we're going to turn this over to Rose from Anthem.
All right, so my name is Celeste Dahl, and I'm the Benefits Administrator for the Kentucky Annual Conference. And I'm sure I've spoken with many of you on the phone over the last couple of years since I've been in this role. So first, what we're going to talk about is eligibility for the plan, which I'm going to assume if you're sitting in this room that you're on the current plan and you're eligible to be on the plan. So in the Kentucky Conference, retiree medical eligibility for medical insurance, it's offered to retired clergy persons, diaconal ministers, or lay employees, and they're entitled to be covered under the conference healthcare plan under retirement. The requirements are you must be covered under the active conference health plan on the date of your retirement, or you must retire under the provisions defined in the Book of Discipline. And then this coverage also, if you're a retired employee, it also extends to your spouse or to surviving spouses.
Trying really hard.
All right, so our retiree medical plan currently, we have what's called a Medicare supplement plan. So everybody to be on that plan must be covered by Medicare Parts A and B. And Medicare, of course, it's a federal health insurance program for people that are age 65 or older. There's 4 parts to Medicare: A, B, C, and D. So currently, everyone, and again, that's on the current plan should be covered by Medicare Parts A and B. And then, of course, you must be Medicare eligible to participate in the current plan. So currently, the plan that we have is referred to as a Medicare supplement. It can also be called a Medigap policy. It's administered by Anthem Blue Cross Blue Shield, just like the plan that we're transitioning to will be. The requirements are you must be Medicare eligible and you must be retired. And that's not to say, I know that several of our clergy are retired from full-time ministry but still have maybe a part-time job where they're still pastoring a local church in a part-time capacity. So that's okay. We're just talking about that your official status with the general board is that you are retired. And again, the current policy is supplemental to your Medicare Part B. So basically, whatever, once you meet your Part B deductible, then whatever Medicare doesn't pay, then the supplement picks up. And then also our current plan includes prescription drug coverage, which is why we've told many of you over the years that you don't need to sign up for Part D because the prescription drug coverage is already included.
Excuse me, are you saying B, sign up for B or D?
Well, currently you should be enrolled in Parts A and B.
Yes.
If you're on the conference health plan, but nobody currently should not be enrolled in Part D because the prescription drug coverage is included in your plan.
I'm having trouble hearing you denunciate those letters.
Oh, sorry. Okay.
Thank you.
All right. So the premium cost to retirees. This is probably one of the most frequently asked questions that we've been receiving. Is what's the new plan going to cost? So the premium cost to our retirees is based on a sliding scale, and this scale is published in the conference journal each year under the Board of Pensions report. So retirees pay a percentage of the total premium, anywhere from 30% to 100%, based on the years of participation that you had in the conference health plan when you were an active clergy person. And then, of course, whatever the clergy person receives, it's transferred to the spouse. So spouses are also eligible, including surviving spouses. The 2014 premium was $387. All right. Now, I don't think anybody pays that full amount because everybody gets some subsidy, and most of our retirees get a 70% subsidy. So again, the 2014 premium was $387. So for most of our retirees, if they had a minimum of 20 years of service in the active health plan, then they pay 30% of that, which is $116.07. All right, and then for most of our retirees, that's deducted from your pension check that you receive from the general board each month. All right, so the new Medicare Advantage plan, it's going to continue to, the premiums will continue to be paid in the same way. So what we'll do is, once you're enrolled in the plan, we will contact the general board for you and notify them to adjust the amount that they deduct each month from your pension check. So the new premium for the new plan is $327.50. So again, most of you, if you receive the full subsidy, you'll pay 30% of that, which is $98.25 a month. And that will just continue to be deducted from your pension check each month. We do have a few surviving spouses and retired lay employees of the conference who the conference actually direct bills for the premium. So again, however you're currently paying for your premium for your supplement is how you'll continue to pay for your premium for the new Medicare Advantage plan. And this chart is the chart that's published in the journal, and it shows, again, based on your years of service, what percentage of the premium you would pay. And again, just again explains the payment of your premium. It's either deducted from your pension check or it's direct billed by the conference if it's not deducted from your pension check. Voluntary plans. We've also been asked questions about if I'm enrolled in the dental and vision plan currently, is that coverage going to continue? And the answer is yes. If you're currently enrolled in the dental and vision plans, nothing changes about that. We'll still continue to bill you for those premiums. So our current dental plan is the Delta Dental PPO, and then our vision insurance is through VSP. One of the features, and Rose can go into this a little bit more when she gives her presentation, the new Medicare Advantage plan does include some limited vision insurance benefits. So it might be something, if you're currently enrolled in the VSP plan, that you might want to explore whether you need to stay in that plan or whether the Medicare Advantage plan will provide those vision benefits for you now. And again, the rates for those plans and the plan summaries can be found on the conference website. The last thing that I'm going to talk about is Health Advocate. Raise your hand if you have ever used Health Advocate services. Okay, good. So raise your hand if you've never heard of Health Advocate. Okay. That's not so good. So what we'll be doing is actually next week is we're waiting to get some materials from Health Advocate, and we'll be mailing those out to everyone with some more information about it. So Health Advocate helps with a variety of issues. They can help you find qualified doctors, find specialists. They can help you if you say you discover that you need to go get an MRI. They can help you find a facility that that's close to you that is the most cost-effective one. So maybe like you say oh well there's this facility here and they're going to charge $500 for an MRI, but there's another one that maybe is just a couple more miles down the road and they only charge $350. So that's something that Health Advocate can help with too. Navigating healthcare claims, untangling insurance issues. I know one of the things that a lot of our current participants, especially with the current plan, have used them for in the past is when there's been issues with coordination of benefits between Medicare and Anthem. And so that's one of the things that they can help if get those untangled for you. They also assist with elder care issues. We've had some of our active members use it when they're in charge for their parents' health care and looking at what they need to do to provide care for their parents. So again, that's the Health Advocate program. It's something you can, again, with the new plan, anytime that you are confused, if you need explanation of benefits, in addition to using Anthem, you can also call Health Advocate. They'll assign you what's called a PHA. It's a personal health advocate, and that person will be with you from the beginning to the end and will help you with whatever issue you have. Right. So is there any questions about anything that I've talked about so far? All right. So I'm going to go ahead and turn it over to Rose. And then again, if you have any questions, we'll be here after to answer those. And that's all.
Hi everyone, can you hear me? I tend to speak low. I want to thank all of you, first of all, for coming today. I know the weather is not the best, and appreciate you driving here for this meeting. My name is Rose Griffin. I'm with Anthem Blue Cross Blue Shield. I'm actually a representative for the company that is assigned to the central region to work with our local Anthem representatives with retiree benefits. So that's my specialty that I work with our local representatives on. We have a presentation today, as Celeste and Joni mentioned. To go over the presentation, I will go through all the slides. If you can hold your questions to the end, because I think a lot of the information is in here, and then we could go over your questions at the end. I would appreciate that. Thank you. This is just the agenda of what we're going to talk about today. We're going to talk about what is Medicare Advantage. I'll explain exactly what the product is, what a Medicare Advantage PPO plan, because that is actually the plan that you will be offered, and are you eligible? I'll show you how to find a doctor in our network. The name of our actual plan product that Anthem uses is Anthem Medicare Preferred PPO with Senior RX Plus medical benefits. That's the product name. So that's something that you will see on all the materials. It's on your book. You'll constantly see that name. The plan includes not only the PPO medical, but it also includes prescription drug benefits. And then we also have benefits for a healthier you, a lot of wellness program benefits that we include in the plan at no cost to you. And then the last section we'll talk about how to enroll in this plan, and then we'll talk about your questions at the end. First of all, what is a Medicare Advantage plan? It's health plan options like PPOs, HMOs that are offered by private insurance companies and that have been approved by Medicare, and they're also called Part C. So it's, Medicare seems to like the alphabet soup. It's A, B, C is the Medicare Advantage, and D is the prescription drug. So right now we're talking about the Part C plan. what insurance carriers have done with Medicare is Medicare has gone out realizing that there's so many retirees now, especially with the baby boomers now coming into play. Over 70 million baby boomers started a couple years ago to go into retirement. So the government has decided to create a product called Medicare Advantage. They've reached out to all the insurance carriers to contract with them to administer this program on behalf of Medicare. So you are still enrolling in a Medicare program. We are regulated by Medicare. Everything we do, we have to report to Medicare. But what's happening is that it's administered by the insurance companies that Medicare has contracted with to administer this program to handle all the additional retirees that have now come on board these last couple of years, and that will continue to retire as we go forward. So it's just an additional program that Medicare is offering. The coverage includes hospital and medical expenses, so the Medicare Advantage plan replaces the A and B that you have today, and then it also includes Medicare Supplement into one plan. So you've got one complete plan that includes the A and the B, which is, and then the Medicare Supplement. So you only use one ID card. We also include the prescription drug, and we have a few extras. We have a little bit of vision in there that I'll talk about later, and then we have the wellness programs. We have very many preventative care programs that we also include in our wellness. Okay, next please. Okay, the PPO plan, what a Medicare Advantage PPO plan, it's very similar to the PPO plan you have today. This is Medicare Advantage though, so it is a separate network of providers. So what it is, it uses a network of the healthcare providers, the doctors and hospitals we have in this network through Anthem. We have the freedom to see specialists. You do not have to see your primary doctor and then ask for the referral to a specialist. If you want to see an ophthalmologist directly, you can just pick up the phone, make your appointment, and there doesn't need to be a referral. So you have that freedom with this plan. And also with this plan, it provides out-of-network services. So, and we'll talk more a little bit about the benefits, but your benefits cover in-network and out-of-network at the same level of benefits. So, and it's called a passive PPO, and you'll hear more about that as well. Next, please. Okay, this goes into the differences in in-network and out-of-network, which I talked about a little bit already. The in-network providers are the actual doctors and hospitals that participate in our network. They agree to accept Medicare. All the doctors in the Medicare Advantage have to accept Medicare. That's a Medicare requirement. That's part of our regulation with Medicare. And they also agree to negotiate a fee schedule that we work with Medicare and offer these providers. So they are enrolled in our network and they're part of the network. Out-of-network providers are providers, hospitals, doctors that do not participate in the network. They are not in the network, but with this product, again, the benefits are paid the same for in-network or out-of-network. So what happens here is they're not required to provide services, but if you're already seeing a doctor that's not in the network, they probably will accept you. There's usually no issues with that. But with an out-of-network provider, again, the benefits are the same in and out. Two things they have to do is they have to accept Medicare. So today with your Medicare Supplement plan, I believe that's already a requirement. So they have to accept Medicare and they have to accept payment from Anthem. Because they're not in the network, we will pay them the required Medicare fee schedule. So that's the only difference between in and out of network. And one of the things I also want to talk about is this plan is connected through all the Blue Cross Blue Shield plans across the country. So regardless of where you're at in the country, you will be covered under this plan. We do have a national plan through this Medicare Advantage, and then also with the out-of-network, we could do that billing situation where they send it directly through the local plan. So you do have that available to you on a national basis. So you're still paying Medicare to be enrolled in their program. And what they do when they contract with the insurance carriers to administer this plan, they pay us a subsidy to administer that.
So we don't have to do anything with Medicare?
No. And, oh yeah, I'm sorry. What happens is we take that subsidy that we receive from Medicare conference and from Medicare to administer this program. So that's why you still need to do that A and B premium. Because remember, this is still a Medicare program, even though we're administering it. Okay? Yes, sir.
About Express Scripts, we keep getting mail from them. Is that part of your program or is that
It
something
is.
separate?
It is. Express Scripts is part of this program, and we're back on, so we're gonna try to continue with the presentation as long as we have it. Okay, so we talked about eligibility, and actually Celeste talked about the specific eligibility for you to be enrolled in the plan, and then to be actually enrolled in a Medicare Advantage plan. You have to be enrolled in Part A and Part B, which we just talked about. You continue to pay both your premiums, the A and B. And the service area is all 50 states, including Puerto Rico, in this plan. And then in addition, there's also an additional benefit. If you travel out of the country, we do have international coverage too. And with that, all you have to do is, since it's not a network, you can be in a foreign country with foreign currency. So what you need to do is pay the doctor provider up front and then take those bills. If it's a different currency than the American dollar, you'll have to have it transferred into American dollars and submit it to our claim office, and then they will reimburse you directly. But you are covered for that. They won't send us the bill. You'll have to handle that up front, but you do get reimbursed based on the benefit level. Okay, next, please. Okay, so this talks about eligibility again. Under this plan, and this is a Medicare requirement, regulation, anyone with end-stage renal disease is not covered under Medicare Advantage. You will stay under original Medicare, and Medicare will be dealing directly with you. This is a requirement of theirs. They do not want it handled under this plan. Your coverage will stay with Medicare. So that's the piece on the end-stage renal. And then you just, if you meet the group's eligibility requirements, then you're enrolled in this plan, and they will send your information to us and your application. Okay, next please. Okay, here's a couple of ways to see if the doctor's in network. First of all, you will be receiving a directory. We do not send it out to you right now during the open enrollment season. You will get it once you enroll. What you can do is there's a customer service number in the letter. It's our first impressions number. You can contact them and they'll be able to help you find a doctor in your area. Or you can call 1-800-810-BLUE. That's our direct number to help you for provider finder, and they will help you find a provider as well. And then lastly, we have a website. If you like to go into the computer, and hopefully yours is better, it works, it doesn't have a mind of its own. It's anthem.com, and we have a provider finder tool. If you're interested in this, we do have a flyer that gives you instructions how to find your doctor. So you can see us at the end of the meeting, and we can hand the flyer to you if you're interested in the website. Next, please. Okay, these are the benefits, and this doesn't list all the benefits under the plan. As you know, in the book that you received, the benefit summary is about 30 pages long. So we just highlighted the most important used benefits that are pretty common. So first of all, the physician copay is $5 for in-network and $5 for out-of-network. And then the specialist copay is $20 copay for in-network or out-of-network. And there is no deductible. It's just the straight copay. And then for inpatient hospital care, prior authorization is required for in-network, and it's requested for out-of-network. We work with these doctors on the in-network, so they have to, it's part of their contract that they have to do it, and then we request it on the out-of-network side. The copay is a $100 copay per admission for your hospital stay for both in-network and out-of-network. And then the emergency care, it's a $50 copay if you go to the emergency room, and if you're admitted to the hospital within 72 hours, that copay is waived. Okay, next please. Okay, and these are our preventive care screenings. This is part of our wellness program, helping you reach a healthier you. We have preventative care and screenings, all at zero copay, no cost to you. That includes the bone mass measurement, colorectal screening, cardiovascular screening, diabetes screening, mammogram, and prostate screening, all at zero copay. And then physical exams, the This plan covers an annual wellness visit once a year, and it's a zero copay for both in-network and out-of-network for your physical exam. And then hearing services. A routine exam is zero copay, but the maximum benefit per year of the expenses is $50. Now, with the hearing services, it's only the exam that's covered. Hearing aids are not covered under this plan, so it's just the exam, okay? And that's not covered under Medicare either. Medicare doesn't cover hearing aids. Okay, and then under the vision care, routine exams are covered, zero copay again, and the maximum benefit is $50 on that. And this as well, it's just the exam. Glasses and contacts are not covered, and those are not covered under Medicare as well. And then your total maximum out-of-pocket is $3,400 for this year. And what that is that's from March 1st through December 31st, 2015. And then starting January 1, 2016, we will start over. So that's just from the beginning of this plan, so for the 10-month period. So once you reach $3,400 during that 10 month, the plan pays the rest of the expenses, and it's no expense to you, so it's 100%. So that's, it's a savings for you and protection on that $3,400 maximum. Okay, Medicare Part D, we're part of the alphabet soup again. Part D is prescription drug. So what this is we have many brand name and generic drugs, drugs covered under the plan. We have different co-pays at different levels, co-insurance, and we'll talk about that in a minute. We give you access to a pharmacy network across the United States. We have a very full, robust network across the country, very names that you are familiar with, grocery stores, pharmacies, so forth. You can predict and control your costs at the pharmacy because you know what your copay is going to be or your co-insurance up front before you go and purchase your prescriptions. And again, what your prescription coverage is depends on the actual category of the drug. So if it's a generic or a preferred drug, that will be the type of coverage that you have. And then we actually publish the list of drugs that are covered. That will also be included in your packet of materials that you receive once you enroll, and it's called our formulary. And it will show the list of drugs. It will show the tier, and your tier is what the actual copay or coinsurance is. So if you go to the next screen, this will make more sense to you. The tier is, these are all the different tiers: generics, preferred brands, non-preferred brands. So first of all, under this plan, we have two types of coverage. We have retail services and mail order services. The top section talks about retail services. It's a 30-day supply. And so this is any local pharmacy, drugstore, within Kroger's, Rite Aid, those type of places, Walmart, included in the network. So select generics is actually a list of prescription drugs that we cover under the plan at zero copay to you. So what I recommend, if you're on a prescription today, you might want to take a look at that select generic listing and see if you're on there, because that will be zero copay. If you are on a prescription today that's not on the list, you might want to talk to your physician and see if he could change it to one of these drugs, because there is a difference in the copay. I've had a couple of friends that have done that, and they've saved a significant amount of money by getting it transferred to one of the generics that are on the list. For regular generics, it's a 20% coinsurance that you would pay. For preferred brands, it's 20% coinsurance, and for non-preferred brands, it's 20% coinsurance. There is no deductible under this plan for 2015. I know that in your prior plan you had a $200 deductible, but beginning in March with this plan, there's no deductible.
For this
mail
year.
order?
For this year.
For this year, for 2015, right. Yes, ma'am?
What about our express scripts that we are now getting from Anthem?
Express Scripts is Anthem's vendor for mail order drugs. So that's what we use, and that's the next category I'm going to talk about, no problem. So we use Express Scripts. Anthem actually has a contract with Express Scripts to be our vendor for mail orders. So we also use them under the Part D prescription drug plan. And with the mail order services, what this is, I'm sure many of you are familiar, it's a 90-day supply for prescriptions. It is sent directly to your home. And again, if you travel somewhere, if you're gonna go to Florida for a few months or whatever, you can have drugs delivered directly to that address while you're gone, and then, get it back on track when you come back. So it's very convenient. The co-pays are the same. You have the select generic with 0 copay, the generics 20% co-insurance, preferred brands 20% co-insurance, and non-preferred brands 20% co-insurance. So the one advantage with this plan is that you're getting 3 months supply up front versus at the retail, you're getting 1 month. There are some pharmacies, not many, but some pharmacies that will give you 3 months supply on the retail side. And if you're currently getting that now, just check with them and see if they're gonna continue to do that. Because they don't have to do that. There's many pharmacies that will not do that. They will only disperse their prescriptions once a month. So if you're getting that on the retail side, just confirm that they'll continue to do that with this plan. Okay? Okay, and this goes into, I don't know if many of you, because you weren't under a Part D plan, but under the Part D prescription drug plan, there's what is called the donut hole, or the coverage gap. And what that is when you reach $2,960, then this donut hole starts. Well, under this plan, and the government created that, under this plan, we cover the donut hole. Under some plans, you have to pay that amount of money, and it's close to over $2,000. But under this plan, you continue to have your coverage, and then what happens is, on the coverage tier 1, you pay 20% after your group after the plan has paid the benefits. The brand name is, you pay 45% after the benefits. And then if you are considered a low income and you have met the requirements that Medicare has implemented for a low income subsidy, your coverage will not reduce, you will not qualify for the coverage cap program. And under the low income, if you feel that you're required for that, you meet that requirement, you may want to contact Medicare directly, and then what happens is your premium is reduced. So that's in rare instances, but if you do qualify for low income subsidy, that is how it would affect you. Next, please. Okay, now what happens is from that $2,960 to $4,700, that's the number that is your donut hole with a coverage gap. Once you reach the $4,700, then your copay is actually reduced. So your generic drug then reduces to $2.65 per drug, or 5%, whichever is greater, and then the brand names would reduce to $6.60, or 5%, whichever is greater. And again, this would be in 2015, and then starting January 1, 2016, we start over again. Okay? Okay, and this is just the smallest of the select generic drugs that are covered at 100%, 0 copay to you. The categories are very common categories. We have cardiovascular drugs, cholesterol drugs, depression, diabetes, and osteoporosis. So if you're on a cardiovascular drug, it may be wise, and it's not on this is just a very small piece of that list. It's a full page listing that you'll receive with your enrollment packet, or your packet once you enroll. Again, take a look at the list. If it's not on there, you might want to talk to your doctor and see if it's something that you can have switched. You may not be able to, but you may. And so it's always something worth it to look into. Okay? So how do you get your prescriptions? Using the in-network pharmacies, you just go to the retail pharmacy, hand them your Anthem prescription drug card. If you're currently using a pharmacy today, you'll want to give them your new card for March 1st. And then they'll disperse your prescription, and then you just pay the copay. With mail order, you have to enroll in this plan, because this is now a different plan, even though it's with Express Scripts, it's a different benefit plan. So what you'll need to do for March 1st is to get a new prescription from your doctor. You'll have a packet of mail order prescription forms in this huge packet of information that you're going to get soon. You fill out that form, you get your new prescription from your doctor, and then you submit it to us, and to Express Script address on the form, and then you'll start your mail order extra step to get it started, but once you do, it's worth it because then you'll get it every 3 months delivered directly to your home address. Now, the one thing I recommend, if you're currently on a prescription on mail order, get your prescriptions so that you're not running out by March 1st. You know, you want to have a little extra so that you can get this up and running. So make sure you have enough prescriptions to get you through until this new program starts, until you get everything going. So that's just a little extra note. Using out-of-network pharmacies, again, we have contracted with pharmacies across the country, all the big name brands. In certain circumstances, you may be reimbursed for drug costs when you get a prescription that's covered by an out-of-network pharmacy. So what happens is you'll have to pay the drug costs up front at an out-of-network pharmacy and then submit it to Anthem for payment, and we will pay the pharmacist the negotiated amount what we pay our in-network pharmacists. So the one thing you need to be aware of when you're going on a network, you have to pay that cost up front. And you know there are some drugs out there that are extremely expensive. So there's so many well-known pharmacies and grocery stores that are part of our network. I really recommend to look at the list and not go out of network because it could cost you some significant extra money just by going on a network. Okay, next please. Okay, we talked about how to get started with mail order. That's where you complete the form and you send it in to us, and then that starts the process with the new prescription. Next please. Okay, care management. These are programs that we provide, what we consider for healthier you. It helps with the wellness programs. One of the things that you will receive with all the materials that you're going to receive within the next month or so is a health survey. What it is it's a document that asks several different questions about your current conditions, your current illnesses, prescriptions, things like that currently are going on. We have nurses on our staff that will work with you in providing you with information, advice as to, if you're seeing 2 different doctors and they don't know they're prescribing different medications, the nurse will look at that. There'll be a survey to make sure that everything is running properly for you. So you will be contacted by nurses and by our health team. Care management is available to help you manage the ongoing health conditions, as I mentioned, and it's an integrated care plan that addresses your physical, social, and emotional well-being. And then the other piece of information is My Health Advantage. This program helps you keep track of your health and progress. It's an online program that you can look at all the different information. There's libraries and things that provide you with all sorts of information online. And it's called My Health Advantage. Next, please. Okay, the health and wellness programs. This is in addition to the survey. This is a 24/7 nurse line. Again, this is something that our professionals are always a phone call away. We have actual registered nurses that work for Anthem, and they're there manning these phones. If you have any questions, you're running a fever, don't know what to do, or you have a chest pain, you don't think it's serious, but you can't get a hold of your doctor, you just want to talk to someone about it. We've got the nurses online, you can call them on the phone. If they think it's an emergency situation, they're going to tell you, hang up the phone, get to the emergency room. If you have questions on medications that you have, you can call them, they can explain what they are. So they're there to help you, in addition to your regular medical professionals that you see. Okay? And then Silver Sneakers. This is a program. There's a couple of things to this program. One, it's a free membership to a network of health clubs. Curves is one that is available. I believe the YMCA is also in there. They actually have an actual network. You can either call them or you can go online and look at their network. And then if you cannot get to one of their facilities, and there's different types of programs that they have, if you like to walk or if you like to stretch or aerobics or something like that, they can send you a kit at home to get you going, to start your routine at home instead of going to an actual facility. So it's a good program. It's included in this plan. There's no charge charge to you. And again, if you are interested in the health clubs, take a look at the network. Those again are for you as well. And if you look on there and you're currently in one of the facilities and you're paying a fee today, starting March 1st, you will not have to pay that fee. Okay? Next, please. So these are additional special offers that we include in the plan. What these are discount programs. So we have for diet, nutrition, and fitness, we have Jenny Craig, Weight Watchers, Lindora, and Living Lean. So you just contact them, show them your ID card, let them know that you're a Medicare Advantage participant with Anthem, and they have appropriate discounts, and they'll let you know what their local discounts are in the programs. The other ones are Puritan Pride, it's for vitamins and personal care. Vision and hearing, although our plan does not cover contacts and glasses, we do have a contract with these organizations where they'll provide you with discounts. And so for vision and hearing, it's 1-800-CONTACTS, True Vision, Premier LASIK, Pure PO, and Belto, and it's for discounts. Yes, ma'am?
And all that information will come in their packet as
Yes,
they enroll.
yes. You're going to get flyers, you're going to have phone numbers. We don't hand them out now, we hand them out, you'll get it after you're enrolled. Okay? Okay, next please. Okay, the next step is, now that we've gone through all the benefits and the procedures, next step is to enroll in the plan. There's an enrollment form in the back of the packet. There's 2 copies actually. The yellow is like a carbon. So submit the white copy once you've filled it out. There's a little square box on the front page. It shows kind of duplicates what the Medicare ID card looks like. Be sure to include your Part A and Part B effective dates. Those are very critical. That will delay the enrollment form if you don't have those dates, because that's proof that you are enrolled in A and B. Because you have to be enrolled in A and B to be enrolled in the plan. So you need that information. The effective date is 3/1/15, which you would put at the top. The plan sponsor is the conference name, so annual conference.
Kentucky United Methodist Church, Kentucky Annual Conference. If you can get some sampling of those words in that box, you'll be fine.
Okay, and the final form is due by January 30th. So if you could get it to the mail to us, send it to the Wisconsin address at the bottom of the form, and you'll start receiving information shortly thereafter.
Celeste, do you have the group number?
I have it
I
with
have
me.
it on my phone, but
It's I have it.
Yeah, just preferred United Methodist Church. I'll write, you might want to spell it out.
Yeah, you
I know,
don't have
no,
to.
you won't see.
It's a new number. As of March 1st, you'll be getting a new group number for this plan, and at the top it asks for the group number. That number is 00218-660.
00218-660. And when there's a box that it says what's the name of the plan, it's written right up there at the top. That Medicare Advantage, right here where it says Anthem Medicare Preferred PPO. If you can get Medicare Preferred CPO into that box, you'll be fine. You know, the form was designed as if we're giving you a choice of 6, right? But there's only the one choice.
Did it ask for plan name up on top? Oh, yeah, but then there's plan name.
Right here, so this right here, so there's like, you just have to write these words right here. Yeah. So, okay, so at the top, on page 1 of your enrollment form, across the top, it should say Anthem Medicare Preferred PPO, and the PPO is in parentheses. You just have to write that in the box where it says, please write in the name of the plan. So just copy those words that are at the top into that box.
Like this?
Yep, exactly, yes.
What about this top one?
We have different Medicare Advantage
that
plans,
should
different
be
names, so
Kentucky
that's why that's asked for.
Because that's the group that you're under.
So we're not gonna go by.
But you know what, as long as you have this number, you'll be.
No, no. This is a brand new group number for Medicare Advantage. The group number you have
That's
today
okay, you know
is for
what,
Medicare supplement.
since you have this
And
number
that
here,
plan is
you should
going
be
away
fine.
as of March 1st.
You'll be fine with that
This is a brand
number.
new group number.
March first is the effective date, 03, 01, 15.
You mean on the Medicare card?
No, on this enrollment form, it asks for an effective
Yeah,
date.
it would really help to,
March
we only
1st.
have one other client we're putting in 3-1, so that should be okay, but where is that? It could delay if we don't have it. Just helps. Okay? No. Alright, next, I think we're almost done. Okay, and this is just a recap, you will receive the new Anthem, you will receive the new Anthem ID card, right after you send your enrollment form, so you'll get all this material before March 1st. That's why it's important to get it in by January 30th, so it gives us enough time to get everything processed and get you out the appropriate information you need by March 1st. So your ID card, I want to go over this again. What you do is you'll get your Anthem ID card, it's for the Medicare Advantage plan. When you see a doctor or a hospital, you only take your Anthem ID card. You leave your Medicare cards at home. You do not need to use the Medicare ID card anymore. You still need it because it has your A and B effective dates on it, but you do not give it to your provider. So once you give them the Medicare Advantage card, they submit the bill directly to us and then we pay the claim. You don't have to submit to Medicare and then submit to Medicare supplement. It's an easier plan to administer for you and for the doctors as well. You don't have to worry about the two plans coordinating. So just that one card. Yes, sir.
Question at the top of page 2, are you the retiree? I understand for surviving spouses, the answer is still yes?
If it's a surviving spouse, the answer to the question is no, they're not the retiree.
Okay, I put that down, and and then you have to come up with all the retirees' information. My mother's 92, has no idea where that is.
The next question, it says if you're not the retiree, then it asks you to put your name, right? And then it asks for your Medicare information. They want the retirement date for the retiree,
Then it says retiree medical ID number. That's the social security number with an A after it?
most likely,
Okay.
yes.
Does
It
my
should
mother,
be on the Medicare ID card, and they call it a HICFA number too.
does the surviving spouse have the retiree's old social security number on their card now?
Well, they could or they could not. If they didn't work, they usually have the retiree's ID card number. So you have to look at the ID card number, ID to get the actual
My
number.
dad's been dead a while, so finding his social security card is not something my 92-year-old mother can do right now.
Okay, and does she have her own, has she received her own Medicare card?
Yes,
Okay, her own Medicare card will have that information.
okay. See, that's different, Celeste.
Yes, sorry, yeah, I might have misinformed you.
That's the reason I brought it back up.
Right.
Yes, yes.
So you would check no here if you're not the retiree.
Let's finish this slide. So again, with the card, you only use the one Medicare Advantage card. Keep the Medicare ID card that you have at home in a safe place. And then you just bring that card to the pharmacy also for prescription drugs. So you use it for all expenses, your doctor, hospital, and pharmacy. Okay? Next, please. Okay. We do have a customer service call center for you. It's called our First Impressions Welcome Center. It's an 800 toll-free number. It's actually in the letter that was sent to you notifying you of the meeting today. And that First Impressions number is there available through the end of February. They're there, if you go home today and you realize you have a question you didn't ask today, pick up the phone and call them. They're there to answer all the questions on this plan, help you get through the enrollment. If you have questions on the coverage, on prescriptions, on the doctors, anything about this plan, they'll be able to help you. And then starting March 1st, your new Anthem Medicare Advantage ID card will have a different customer service number, and that's a customer service number for enrolled members of the plan. This right now is just to get you through open enrollment. Anthem. I'm sure you're all familiar with it since you've had if you were active, you're under the active plan. If you had the Medicare supplement, and you're familiar with Anthem that way. But 1 in 3 Americans carry a Blue Cross Blue Shield ID card across the nation. We offer quality products, information, and services that you can access to what you need. And we have innovative wellness and preventative care programs, as we discussed. I think you'll agree they're really good programs for you to have a healthy lifestyle. And then we provide all the resources that you need. You know, we have phone numbers, we have the website. So please be sure to use them all in getting comfortable with this plan and becoming familiar with it. And then the www.bcbsa is actually the association's website in Chicago that gives you information about the whole entire Blue Cross system across the country. So I know we had some questions. Are there any other questions today? Yes, ma'am.
If the doctor prescribes a medication for a special treatment and the drug is not listed on your plan,
Okay.
can you call the company and get?
Okay, under this plan, we have a closed formulary. I'm sorry, her question was if the doctor prescribes a prescription that's not on the formulary list. Under this list is a closed formulary, so normally what that means is it's not a covered prescription, but I would definitely call Anthem, and I would also let Joni know that you've run into this situation, and then they'll look at the drug and see if there's maybe an alternate drug that they can get you, rather than that one that's not on the list. Okay. Yes,
I
ma'am.
noticed that we're covered for 1 year with physical exam.
That's correct.
Currently, we go every 6 months, will one of those not be covered?
Well, the annual, her question is, annual exams are covered once a year, but they go every 6 months for an exam. Now, for the every 6 months, is that for a recurring condition, or is it an annual physical?
No, it's not an annual physical.
Okay.
It's recurring.
Okay, that's the difference. If you have a recurring exam with your physician, that is not considered an annual physical exam. An annual physical exam is just testing your blood pressure, you're taking a blood test to look at cholesterol, maybe thyroid levels, things like that. It's more of a wellness visit to see what's going on. If you have a regular scheduled doctor visit for an occurring condition that you have, maybe you have a heart condition or thyroid condition or something, that cholesterol, things like that. And you have a regular visit with your doctor, as long as there's an underlying medical condition, that's not considered a physical. Okay?
You did okay.
Yes,
Good job.
On this page here, when it talks about the prescription drug coverage, it says a deductible of $200.
Okay, good point. I'm glad you brought that up. Forgot about that. Originally, when we had, her question was, sorry.
Yeah.
The question was, on the book itself,
did you
it
get
shows a
Medicare
$200
benefits through
deductible for the prescription.
Yeah, you would put that.
Originally, there was intent of putting this
Do you want me
plan
to write
as
it?
of January 1, but since you have a $200 deductible on the Medicare supplement, the conference, Joni decided to eliminate it under this plan. So these books were already printed with that, so disregard that $200 deductible. It does not apply to you under the new Medicare Advantage plan, the Part D plan.
This is kind of a big point. I want to make sure we hit that one again. In your booklet, it says that there's a $200 prescription deductible
Yeah.
that would
Yep, so
start on
that's
March 1st and go to December 31st. We've eliminated that because you have a deductible right now that starts January through February. And we didn't want to put you in a situation where you had your deductible twice. So the conference, the Board of Pensions, is basically paying your second deductible for you for this year.
But like next year.
Next year, it's just gonna be a $200 deductible for the whole year. Yeah. So we just didn't want you to get caught with the old plan and the new plan, having the $200 twice. So we're paying that this year.
Okay, and then I have another question. Under, like when you had the vision, slide up there, it said there was, like no copay, but then it said the maximum benefit is $50, I think. So does that mean if the vision, visit cost over $50, you pay, the balance? Is that what
Yes,
that means?
the maximum benefit that we would pay is 50, right? So
So there really isn't a copay, but if it costs $74, you pay $24.
Right,
Okay.
but there's no upfront, right. And what her question, I'll reiterate that. Under the vision, there's a zero copay, but there's a maximum of $50, and what that means is if the, like her example is if the exam is actually $74, you would have to pay the $24 balance because we only cover up to 50. Okay? Yes. Yes, ma'am.
You go to the doctor and you pay your copay. What if you have a follow-up visit? Do you pay the copay again, or is it based on how the doctor writes it up?
Okay. It's every time you go to the doctor, you have the copay. It's a per visit copay.
Okay.
So, that's what's required under this plan.
What if he also requires a lab visit, blood work and so forth? Do you pay
Again,
the copay for that as well?
well, it depends. If under a lab, she wants to know if the lab visit also requires a separate copay. And you made a good point with your previous question, is it the way he bills it? If he bills it as a office visit, you'll have to pay the office copay. But if it's not billed as an office visit, usually sometimes they do it right in their office. So it just all falls under that. But there is a different benefit level for labs, and it's in the booklet. We can look that up for you. So it depends how he bills. Yes, ma'am.
Rose, we're over here.
Oh, I'm sorry. Hi.
This is just more of a general insurance question concerning maximum out-of-pocket
Okay.
money. If you have that covered, you paid all your maximum, all your out-of-pocket, and everything should be non-charged, then go into the hospital in December for a surgery, and still there in January, does it pick back up again, or are you
It
covered?
starts over January 1st,
So you better schedule your surgeries early.
Question? Would you hand that to her, please?
I just needed an answer about the spouse signing. I didn't see anything on this form for the spouse or for Medicare or anything. Maybe I'm wrong.
Now, each of you need to complete your own form. You should have the retiree and the spouse should have gotten their own kits. If you did not, you definitely need to complete two separate forms, because Medicare recognizes you as two separate retirees, so we need a form for each of you.
And for the spouse, are you retired? No?
The spouse is not the retiree.
Okay.
The question on that form says, are you the retiree? And it's yes or no. And, if you're the spouse of a retiree, then the answer is no. Right? If you are the retiree and asks you for your retirement date, if you don't know your retirement date, you can call Celeste and she can look it up for you. And anytime Rose says call Joni, she really meant call Celeste.
Any other questions for the body?
Yeah, I just had a question. We're kind of new at this, but it all hinges on whether Medicare covers something, correct? If Medicare doesn't cover a test or something, for instance, like I was told by the doctor that mammograms for if you're over 65 can only be every other year. So that means like if you want to have one annually, like your doctor recommends it, then do you pay that yourself because Medicare's not going to pay it?
Okay, the difference of this plan and her question is, if Medicare doesn't cover it, will this plan cover it? Under this plan, Medicare required that all Medicare Advantage plans cover what they cover and then additional things we put in. So if there's a limit on mammograms, we actually cover mammograms once a year. But if your doctor requires it as a medical test that, he's suspecting something and he needs regular testing, they'll be covered. We will look at those. It may not be covered at 100%, but it'll be covered as a test.
What if it's just a preventative thing?
Well, as a preventative thing, you have one a year.
You can, but Medicare only covers.
No, it doesn't. Forget what original Medicare is. This plan replaces that. Totally replaces original Medicare benefits.
Well, that's not what your thing says. It says all the benefits that original Medicare offers.
Plus some.
Oh, plus some.
So basically,
Well, you don't have to take advantage of
Right,
them.
it has all the benefits that Medicare offers, but if Medicare, like for example, Medicare doesn't cover the additional benefits, which we provide. We take, Medicare has,
your
the
medical
separate
advisor, you
deductible
don't
for
have
the
to ask
number of
questions.
days in the hospital. You just have to.
He just tells you what to
So
do.
this actually improves the Medicare.
That's exactly right.
Because it's combining the original
Praise
Medicare
the
and
Lord.
Medicare supplement.
I don't want to worry about that.
There's a question on the floor, let me, answer. Somebody asked about retirement date. If you know what year you retired, the answer is June 30th.
Quentin, what if you can't remember whether you're retired or not? You're in big trouble.
There's some people like you that keep going.
You're Christian Catholic.
Okay, so let's say I'm wrong, it's July 1st.
The general board of, for most of you, the official retirement date that is on file with the General Board of Pension and Health Benefits would be July 1st. But, I mean, if you have any questions about it, you can call me on Friday, because I won't be back in the office till Friday.
Any other questions? That's why we're here today, to answer all your questions on the plan.
Celeste, your phone number is?
don't give up.
I do have some business cards with me, so if you'd like one of those, you can see me afterwards, but the conference phone number, and I don't know the toll-free one off the top of my head, but I know the local one, it's 502
425
425.
3884.
I know.
We know.
I'm giving people a chance to write it down. 3884. And my extension is 307. So if you call and Lynn's not there to answer the front desk phone, then if you dial the extension 307, then that will take you to me. So I'll repeat it one more time. 502 425 3884. And that's our phone number for the conference office. And then my extension is 307. Yes. And my name is Celeste. I'm the benefits administrator. So
We have these filled out, did we leave them with you today, or do we still need to mail them in?
You might want to make a copy of it for your records. Okay, and then, I don't have an envelope, so.
yes. Yeah.
Yeah.
We're going to be traveling because this is our second meeting out of 5. So tomorrow, Wednesday, and Thursday, we'll be in a different city across the state. So I would recommend that you mail it yourself, just because I don't want to be responsible for that.
Jack, you have a question?
Jack asked if you can put two applications in one envelope, and I would, surely that would work. It might need more postage. There's on the fourth, I said that. On the fourth page of your application, there's an address in Wisconsin to mail it to. Any more questions? If y'all got individual questions about filling out your form, we'll stay as long as y'all are here. But if you got any questions for the whole body, let me hear them now.
This is an announcement, this isn't a question. ARMS, our retirement group, is meeting here, Centenary, on Ash Wednesday, which is February the 18th, for our regular noon meeting. So if you'd like to come, please make sure you make a reservation with us. We're delighted to see you. It's Ash Wednesday, we have some kind of program about that.
Brother Coy, you want to send us forward?
Friends, I want to say thank you again for being here, and I realize that this change produces angst, and I apologize for that. We got this information so late in the year about this huge increase in the plan that you are currently in, and there was so little time for change about that. I do want to give kudos to Anthem for extending that time of the deadline of March 1 for you to stay in this current program to give us opportunity to make this this change to the Advantage plan. I realize that we don't always do change well in the church, but I appreciate your time with us today, and we'll get through this in time, and I appreciate your good spirit about it. So, peace and grace to you. I want to say thanks to our host, Brother Tom Green, who's back there and serves on our Board of Pensions and the chair of our Benefits Committee. Skip Little is with us as well and chairs our Finance Committee. And this Board of Pensions is working very hard on your behalf, and I know that they are trying to find the store in your behalf. So peace and grace to you as you travel today. The Lord bless you and keep you. The Lord be gracious unto you and give you peace. Amen.
Also, before you leave, if there's anyone that, we had a sign-in sheet that was being passed around. If there's anyone that didn't get a chance to sign in, I'm going to have it up here. And if you wouldn't mind signing in, we're just trying to get an idea of how many of our retirees